I'm going to go ahead and start so we can keep rolling on the schedule. My name is Sean Lawler. I was prior Air Force. Currently, I'm a supervisory special agent with the U.S. Drug Enforcement Administration. But I'm not here representing DEA. I'm here on my own personal time, so the opinions I'm going to be expressing are my own. With the DEA, I'm currently the Chief of Training of the Aviation Division from my Air Force background. So I do, we're up in Fort Worth, Texas at our aviation headquarters, but I'm also in charge of our firearms training, our tactics. I'm also a tactical medic with the DEA, so I'll reference some things along those lines as well. Nationally registered EMT. A lot of law enforcement agencies have tactical medic programs so that you have cops that are right there to immediately apply medical interventions before the EMS gets there. And I also do our active shooter training for our facility. I train the agents on how they'll respond, and then I train the civilians, our contract employees and our DEA employees as to how they'll respond as well. So the subjects I'm going to be talking about are very near and dear to my heart. I first met Chuck probably 12, 13 years ago. It was actually at the Wedgwood Baptist Church that he referenced. There was an active shooter attack there up in Fort Worth. I was there for a sheepdog seminar. And actually one of my sons who was going to a Christian school up in Fort Worth, his teacher lost her daughter in that attack. So that's where I first met Chuck, and I was putting together the security program for my church and also coordinating and working on the one for our school, all private Christian school. And one of my concerns was I want to provide assistance to them, I want to provide training, and I'm limited as to what I'm allowed to do. I can't do quasi-law enforcement until after I retire from DEA. I still wanted to provide training and assistance, but I wanted to protect myself and them from liability, and that was what Chuck talked about, and I said, well, this is perfect. So I put my guys on my church team through Chuck's program, and so now they're licensed. So we did our due diligence. They're licensed to the state of Texas. They're trained, and now, most importantly, they are employees of gatekeepers, not volunteers at the church while they're on duty, and they're covered under gatekeepers armed guard insurance. And then we did the exact same thing with the school. So that was very, very beneficial, especially with for the liability protection. And actually met Colonel Grossman even before that, probably 5 years before that, when DEA brought him up to the New Jersey division when I was up there. But one thing I noticed about Wedgwood was amongst all the speakers, the senior pastor spoke, and this was years after the attack had occurred, but it was very obvious to me that the school was, or the church was still suffering from trauma. And it was still a very raw event when you're talking to the pastor and those that actually went through that experience. And I think that is an area that's really underserved. We do a much better job at talking about preparing security measures, training for the actual moment, but I feel that we're really not doing as well talking about the aftermath, because it's years, it's life-changing should something happen at your church. And I've taught portions of this content to the ALERT conference, to law enforcement audience that was referenced earlier, to physicians, to DEA, EMTs and agents, and also to some other organizations, including the International Law Enforcement Academy in Hungary, in Budapest. We had foreign law enforcement officers, including Ukrainians, who were police, but they were getting ready to go to the front lines right after the course. So they had never had this type of training before. So some of the things I'm gonna talk to you about, you may be completely unfamiliar with, but it's absolutely critical. It's a very, very important part of your safety program that you have. On a personal note, I'm going to share something with you because I think it's very important. We're all going to go through tragedies in our lives. And mine personally, I went through a Category 5 storm equivalent, the loss of my spouse a few years ago. Now, when they rank order things that are traumatic in your life, loss of spouse and loss of a child are the two, they're 100 out of 100. They're off the scale. But what Satan meant for evil, I was able to, after a period of time, use for good for the glory of God, because I was knocked completely down. But it's when you're at those darkest times in your life, when you have nothing else, that's when you really cling to Jesus. And when people around you they may know you're a Christian, but they're wondering, like, how are you able to deal with something that traumatic and still be able to stand up? And I was able to, one, become closer to him than I ever have been before in my life. Two, I was able to share his story with more people than I ever have been before, because people are coming to me offering support, but also wondering, like, how are you making it through this? And three, it really kind of gave me more of an over-the-horizon perspective on everything. We get so bogged down with this life. You know, this is all we see. It's right in front of our face, but this is just a vapor. I mean, this passes so fast. And I've become much more over the horizon, much more heavenly thinking in my focus on everything and the things that I value, the things that I prioritize. As my pastor has put it just last Sunday, there's purpose in suffering, right? There can be. You can gain things from suffering. It builds perseverance, it builds character, but it also can make you much closer to God. And he says every time we go through suffering, we relinquish a little bit of our grip on this life, and we hold on a little bit tighter to the life that's to come. And that's an important perspective, I think, for all of us to keep in mind. And when I share these types of things with audiences, especially this size, I know there's individuals in here that are going through some pretty weighty things themselves. And often people don't, you would never even know it. You may be sitting at the same table with a friend, and you may not even know kind of what they're going through. I know I didn't let people know when we were kind of going through things, but I know there's people in here that are going through those things. So the information I'm going to share with you, it comes from subject matter experts in their individual fields. But I can also anecdotally tell you that everything I'm going to be talking about with you today, I've personally put in place in my own life, practiced these things to very great effect. And so if it can work for me, it can work for you as well. Often when I talk, there's different career groups that I talk to, different fields, and a lot of them have maybe not gone through trauma, but they witness it. Police officers are a big one. Physicians, paramedics, and you take that on to yourself almost like it's happening to you. Now, in this kind of context we're talking about, we're kind of focusing on some of those active shooter events, those violent attacks, and those things last for a lifetime if you're actually part of those. But even if you're just kind of watching it on the news. Now, the Columbine is the big one that kind of the whole nation, I think, got really enveloped in. This one didn't affect me that much because I think I was deployed at this time. I wasn't a parent yet, so I wasn't really following it. And if you're a parent in here, you know things hit you much differently once you have children. So it was really Sandy Hook that really hit me in the gut because my younger son was that age at that time. And interestingly, I've seen one of the moms whose son survived this attack. I've sat through her trainings at conferences many times, and she sat through mine. And I've some of the things that enabled her son to survive is what I teach our civilians at our facility. But when it's an attack on children, that's a whole different level when children are the victims. And we talk about all these different types of things. Those are maybe not directly involved, but are just present. It takes its toll upon you. Law enforcement careers is the case. Like I said, medical, firefighters. But if you're involved in church security, and it doesn't have to be an active attack, or the worst case scenario, you're going to lose members. And people are going to be grieving. And so we need to know how to help them. How can we come alongside and help them? Some scientists believe that one of the reasons that other things that are happening even across the nation affect us so profoundly is based on the discovery of what are called mirror neurons. They were actually discovered by accident by Italian researchers as they were studying the macaque monkeys. They were studying neural pathways in their brain and what was firing while they're grasping food and eating. But they noticed while they were eating lunch that the same pathways were firing in the brain when the monkeys were just simply observing the researchers eat their own food. So there's some to this may be some of the one of the reasons why we have empathy for others, almost as though that event is actually happening to ourselves, because those mirror neurons are mirroring the trauma that we witness someone else going through suffering, and we almost take it on ourselves, and that can become cumulative. There's a good book called The Body Keeps the Score, and it's very, very true. Trauma events throughout life are cumulative, and there's things that we need to do to be able to reset our nervous systems so we don't reach the tipping point when those storms are going to come. Probably all familiar with the Erkey-Dodson curve, the stress performance curve. Well, this also applies to the area of post-traumatic growth. I'm going to talk a little bit about that because we think when we talk about suffering, or we talk about attacks, things like this, and all the bad that comes out of that, well, they have found that many survivors can actually grow and become better in so many ways after the trauma. Now, some people get destroyed by the trauma, but other people consciously make the decision that they're going to move forward and reprioritize in much better ways. They found, especially like cancer survivors, there are many that credit that diagnosis with one of the greatest blessings of their life because it caused them to stop putting so much emphasis on the little things that don't matter in life. They reprioritize their relationships, not only with friends and family, but with God. So sometimes these things can be used for the good. We can snatch victory from the jaws of defeat. But they've also found, when you talk about post-traumatic growth, that people that are most resistant to any type of change, they're also resistant to that type of growth. And if the trauma is too far, way up on the exhaustion side, way on the far right, they don't experience as much post-traumatic growth either. They found what really triggers growth following trauma is it's like an existential wake-up call. Like I said, people reprioritize relationships. There's a new appreciation of life. There's spiritual changes in humans that they'll try to now really reprioritize their relationship with God. And new possibilities in life that they thought was never possible before, they're like, life is very short, I'm going to jump on that. They gain new self-perception, it affects their interpersonal relationships, and it really changes their philosophy on life. Right now, you're probably all familiar in the news, they talk about high rates of anxiety and depression. Well, according to the World Health Organization, that's the number one cause of disability in the world, affecting as many as 1.1 billion people. Now, we can choose to take control of our lives so that we don't become casualties in the wake of these things. There's probably people in here struggling with some of these things. Well, we have to have the mindset, build a guardian mindset that you all in here are, and move from the perspective of victim or patient into survivor and rescuer. And that's very, very important. Viktor Frankl, I don't know if you've ever read his work. He's a survivor of the most extreme of traumas. He's a survivor of the Holocaust. He wrote Say Yes to Life, Man's Search for Meaning. And he lost everything in the most horrific of conditions in the concentration camps. He lost his home, he was forcibly moved, lost his job, lost his parents, sibling, even lost his wife as well. And he was trying to treat prisoners. He was a psychiatrist, continued tried to treating Jewish patients even inside the camps. And it was his conclusion throughout all of that everything can be taken from you with one exception, and that's your ability to choose your own attitude in any given set of circumstances. That's the one thing you retain no matter what. It's important to understand what's happening in your body when we're going through especially extreme stress. It could be any type of stress though. You're all very familiar with the fight or flight response. That's an automatic reaction within your body that's amping you up, ready to respond to some sort of stress or some sort of threat. Things happen like your heart will start beating very, very fast. It'll start pounding because it's trying to get as much blood throughout the body into the brain, as much oxygen flow. That's why you start breathing really fast too, same thing, trying to take in more oxygen. And there's a cascade of neurochemicals that start flowing into your bloodstream, including epinephrine, adrenaline, but also cortisol. And cortisol serves a very important function. But if we stay in this constant fight or flight state, that cortisol stays constantly at high levels, that has very, very bad effects upon our body, upon your physical health and your mental health as well. Dr. John Leach wrote the book on psychology of survival. He found that in studying all these different types of disasters, whether it be volcanic eruptions, fires, shipwrecks, airplane crashes. That fight or flight response is definitely there, but it was an internal response. He noticed across all these different types of scenarios, the number one outward response initially was the freeze response. In fact, he coined the term statue syndrome because he saw it over and over and over again. People frozen in the face of danger when we should be moving and getting off the X, as we talk about, but people are just frozen even though they remained in imminent danger. Braca kind of likens it to that initial freeze response that you see in nature. It's like that stop, look, and listen. And it's a state of hypervigilance, the brain trying to search for what other danger is out there. And then it can move into fighting an attacker or fleeing from the threat. And there's also the fright response, which is tonic immobility, which is seen in nature, but also in people if there is a belief that you can't escape from whatever the situation is, and that it's just a complete shutdown. Whenever we're going to do some sort of behavior, like fight or flee, or really anything, there's movement amongst the chemicals within your brain. It's electrical, but then it has to move across these small gaps between the neurons, which is done by little neurochemicals that are released within the synapse, and it translates. But if there's too much of that, it can have some pretty profound effects. Up here you can see and we're going to talk a little bit about how the brain is organized, because that's very, very important to understand in neural function. The blue section up there, that's your prefrontal cortex. That's where your higher level thinking occurs. When you're learning something new, you're practicing something, you're thinking through a solution. The pink areas, that is your area of automatic response. That's made up of the limbic system, where emotions reside, and memory when you learn things new, but also your amygdala. That's kind of like the fear center. And that amygdala can actually take control. Normally, like right now, your prefrontal cortex is in control. But under extreme stress, under the threat of violence to your life or those around you, that amygdala can take control. And what happens is they found that, remember I talked about normally there's a release of different neurotransmitters in that synapse so the signal can cross. Well, if there is too much, if there's a flooding of things like epinephrine and dopamine into that system, it overwhelms the system and a channel opens up on the receiving neuron and the signal is lost. It's almost like a train just jumping the tracks. And what that does, that amygdala then hijacks the whole system, and it can lead to complete cognitive breakdown. It brings your prefrontal cortex completely offline. This is why Dr. Leach witnessed people freezing in the face of great danger. And why you see that if you look on YouTube videos, if you look at some of the more highly publicized attacks here in our own country, you see a lot of these types of behaviors because that amygdala has taken the prefrontal cortex offline, which can be very deadly in our line of work and the things we're trying to do. Those freezing behaviors can kill. Whereas moving, we talk about getting off the X, that's the unstable area where the danger is, that often leads to survival. Dr. Leach talks about a few different case studies. There was this airplane fire in Manchester, UK in the mid-90s. And this fire occurred on the tarmac. So you would think, well, everybody should have been able to get off. And that's the official British report's question. Why didn't everybody get off this aircraft? Well, some of those that survived, they reference seeing people frozen in their seats with their seatbelts still fastened until they were engulfed with flames. That's statue syndrome. Same thing, Dr. Leach talks about the sinking of this ferry, the Estonia, off the coast of Finland in a storm, also in the mid-90s. Exact same thing, plenty of lifeboats for everybody to evacuate, a slow sinking, but survivors reported seeing people on the stairwells, gripping the stairwells, unable to move, frozen. Once again, statue syndrome. So Dr. Leach wondered, what's the percentage of people that will actually respond appropriately under these types of life-threatening situations? He found it's only about 10%. He estimates what are the numbers that are going to be actually bewildered and stunned, they're going to have difficulty thinking. That's another 75%. And then you're also going to have some who exhibit extremely ineffective, inappropriate behaviors, like sobbing, screaming uncontrollably, attacking the rescuer. This is pretty common too. And that's another 15% of the population. So how can we overcome this? How can we get into that 10%? Well, often it's through if you've had the right life experience or the right type of training. Now, if you're not in law enforcement, then training is what we have to gravitate to if we don't have that life experience. There's a lot of barriers, though, that we have to overcome. One that you're probably familiar with is perceptual distortions. Those are very, very common. One of the most common ones that's reported when somebody's held up by a gunfight or held up by an armed attacker is they gain tunnel vision and the brain wants to automatically focus on that threat to life, which is the barrel of that gun. So often they'll say, I can't describe what the attacker looked like, but I can tell you exactly what type of gun it was or what the gun looked like. Because the brain will focus in on the narrow area that's the greatest threat, and everything else around the periphery will become fuzzy and indistinct. This is actual gunfight data that is referenced from police gunfights by Artwell and Christensen. Auditory exclusion is very, very common, where the brain will actually shut out sounds, even very, very loud sounds. There's stories of officers who were involved in gunfights and they thought that their gun was malfunctioning because they didn't hear it going off. That's auditory exclusion. Tunnel vision is also very, very common. That's what I just showed before, where it's almost like you're looking through a soda straw. That's very dangerous as a perceptual distortion because that's limiting the amount of information that we need to be able to be taking in for a situational awareness of an environment. Automatic pilot is very, very common. We're going to talk a lot about this, and that's all based on the training that we've experienced. Visual clarity increases. Often time will slow, and there's often memory loss. This is why we don't give statements if there's a critical incident. Police don't give statements right away. And often, people that are involved in critical threats, they'll swear they did something that they never did, or vice versa. Disassociation is also very common. That's a coping tactic when we're in certain type of situation that's life-threatening, and the brain wants to automatically pull us out of it. Sometimes there's intrusive thoughts that have nothing to do with survival that will intrude when somebody is actually in the middle of a life threat. Memories are distorted and sounds will intensify. Sometimes time speeds up, but there's also temporary paralysis. Now, this is statue syndrome, and I think that this number is actually much higher because these are self-reports, and it's probably more common in rookies or police officers from this interview data that had less experience with the violent side of life. But how many guardians are going to willingly admit, even to themselves, that they were paralyzed in the face of danger? So that one's probably much higher. Interestingly, there's also the loss of the ability to see in color. And I think that may be one of the reasons why, if you notice in your hotel, if you're staying in a hotel while you're here, you notice they've changed the colors. The exits used to always be red like this. Now, often they're green, right? One, I think red is associated with stop, green is associated with go. But also, red is one of those colors that is often unable to be detected in the face of extreme stress. Also, near sight may go away too. I've read case studies of people that couldn't see the numbers on their phones to dial 911. The other important thing I've noticed with the exit signs, when I was out in Las Vegas presenting at a conference, this was several years ago, it's very common out there, especially due to one of the big MGM fires that they had out there. But the exit signs will also be down near the ground. So why is that? Well, because if there's a fire, there's going to be smoke up high, and you're going to be down on all fours where the only breathable air is, and that's the only area that you're going to be able to see. So I thought that was pretty interesting. Now this fight or flight response, it's not just, we think of like the worst types of scenarios when we're talking about active shooter, violent threats, something like that, but it also can creep into our lives all the time for any type of threat or stress that we're undergoing. It can be the fight response, if we're overreacting to things or lashing out, things that really shouldn't bother us that much, but for some reason it really made us explode. It can exhibit itself in the flight response, and it can show itself in the form of withdrawal or anxiety, or the freeze response also, which can manifest itself in procrastination or total withdrawal. It can affect relationships. Certain careers are much more likely to be experiencing this. We look at law enforcement. In one study by the Association of Chiefs of Police, They found most law enforcement officers, vast majority, experience critical stress. But the important thing to take away is that still only a slightly smaller number had unresolved mental health challenges because they weren't allowing their nervous system to return to baseline. They weren't doing those things that they need to do to maintain their own physical brain health. And that can manifest itself in a lot of different ways, like coping behaviors that are very ineffective, like alcoholism, just feeling overwhelmed, withdrawal from relationships, symptoms of burnout, which is very common in law enforcement, very common in medicine, but also other jobs as well. And in 2015, they did a very large survey amongst 4,000 EMTs and paramedics, and we're looking kind of the same things, and they found that the vast majority also experienced critical stress, but 37% actually contemplated suicide because of the types of things that they were seeing over and over, and 6.6% actually attempted suicide. Very similar numbers with physicians as well, especially during COVID. The cellulose general adaptation syndrome, this is kind of that fight or flight response. Initially, you'll have an alarm stage. Something caused a release of those neurochemicals that started your heart pounding. But normally, it's the way we're designed is that should return back to baseline, back to homeostasis. But if it doesn't, we can reach what's known as the exhaustion stage. And when that happens, when it's chronic, amped up fight or flight response within our body, it can lead to physical diseases. All the big killers, cancer, stroke, heart disease, dementia. It can target full body organ systems, cardiovascular system, and the central nervous system as well, causing diseases of the brain. Now, I want to talk a little bit about, it's important to understand how the brain is divided. If you've ever read Thinking Fast or Slow by Daniel Kahneman, he refers to the two systems as 1 and 2. In Dr. Elizabeth Stanley's outstanding book, Widen the Window, which I'm going to reference quite a bit, she calls that the thinking brain and the survival brain. The survival brain is that emergency alert system. There's immediate danger. It's automatic, it's bottom up. It's the amygdala, your brainstem, with automatic reactions. And very importantly, it's also nonverbal. It cannot communicate through language with your thinking brain. It's nonverbal. It may communicate through a racing heart, through tightness of your chest, through other types of symptoms, but it can't use words. It's just looking for that button to press to get you out of the danger that you're currently in. It's very, very fast. It uses very little energy, very little glucose. No working memory is involved in it whatsoever. And it's constantly engaging in a process called neuroception. Even right now, your entire day, your brain, your survival brain, is scanning your environment and doing continuous threat processing. It could be a physical safety thing. It could be a conversation with a coworker. It could be anything that your survival brain detects as some sort of threat to your well-being or to your life. And it fills in gaps automatically. It does not like to have any gaps in its information, but it's often wrong if it hasn't been given the right training or life experience, because it's going to be on autopilot. So that's why training is so very, very important. System 2 is your thinking brain. It is very, very deliberate, effortful. When you're in school, you're using system 2. Anytime you're learning something new, requires very high levels of energy. That's why after if you remember back, if you take a long certification test or something like that, you're tired at the end of it because you've expended calories. You've physically burned calories in doing that. And it uses large amounts of working memory. It's your cognitive thought. It's top down. It's that prefrontal cortex we talked about earlier, where your executive functioning and decision making is involved. But it's easily disrupted. A lot of things can disrupt that thinking brain from doing what it needs to do. Things like if you're exhausted, if you're hungry, if there's a deadline, or if you're under emotional stress, like depression or anger, or like we talked about, your elevated heart rate. That can actually function to throw your thinking brain offline, or at least impede its ability to be able to think through something. That's why I'm going to give you some other techniques that you can use to bring your heart rate down a little bit that can hopefully keep your thinking brain online and connected when you need it the most when you're doing your duties. Lawrence Gonzalez, in his excellent book on survival, talks about the likening of these two systems to the jockey and the racehorse. The jockey is like your thinking brain. It has all the training and all the knowledge, and the racehorse is that survival brain. Incredibly powerful animal, but can either win the race or explode in the gate. It all depends whether that information has been able to be transferred from the thinking brain under calm and controlled conditions into that survival brain for use under automatic conditions. And optimally, these two systems are functioning as allies. But sometimes the survival brain detects some sort of threat, and it's going to start sending out warning flares to the thinking brain. Remember, it's nonverbal, but still it's going to be sending signals to your thinking brain saying that we're in some sort of danger. And it will be heard. You can't simply ignore it. Sometimes you have like this jittery feeling, you're anxious, you can't really put your finger on why that is. That's your survival brain trying to communicate to you, saying that it feels like it's in some sort of threat. There's something wrong. And if the survival brain is not heard, if you just ignore it, they will then function as adversaries against one another. And this can lead to dysregulation of your nervous system. Elizabeth Stanley talks about this in her book. You can think of it in terms of a cup that is filled up with water. That water is stress. The more stress it goes in there, eventually it's going to overflow, and if it's too much, it can actually break. Your nervous system can break from too much stress, or you exhibit some of those other fight or flight responses where you're lashing out at people. Widen the window refers to the window of stress tolerance that we have. How wide is that? A very, very wide window, well, you're doing pretty well, and the stress that comes your way during this day, you can handle it because you've got a lot of extra reservoir capacity. In the worst of cases, you're having to deal with somebody who's more than just a disturbance at church, but a violent threat. You can't afford to have your window be so narrow that you can't absorb any more stress. You have to take practices, make them habitual, that will widen that window every single day of your life so that you can respond in the appropriate way. There's a lot of different symptoms of dysregulation, tons of them. All the classic symptoms of PTSD, but other things like having chronic fatigue. A lot of these things, you may not even realize they're undiagnosable. You may tell the doctor, like, I'm just really restless, I'm feeling nauseous, I'm constantly tired. And they may say there's nothing wrong with you, but it could be in a dysregulated nervous system from not having a wide enough window to be able to incorporate more stress if you need to. Brain fog, having trouble thinking and concentrating. In the worst of cases, ruminating over things, depression, suicidal thoughts, inability to control your emotions, panic attacks, withdrawal from relationships and society, apathy, survival guilt, existential crisis. It can lead to addictions and self-destructive behaviors. It can affect your relationships. And without recovery, that chronic stress can lead to inflammation, which is upstream of all sorts of diseases, but also anxiety and depression. One of the things that, and she goes into length, she's contracted by the Department of Defense. She's a professor at Georgetown University, but under contract with the Department of Defense, she put together an 8-week program that deals with present moment awareness for combat veterans, particularly Marines that are suffering from extreme PTSD, and she's had phenomenal results from it. Present moment awareness is, and I've become more and more of a believer in this, we spend so much of our life just running ragged from one thing to the next. And often there's anxiety from worrying about the past or worrying about the future, and we're not spending any time in that present moment. And actually, they're using present moment awareness to treat patients that are suffering from addictions, but it helps us deal with anxiety, focusing on the very present moment where we're at. When I talked to the Wellness Medical Society a couple weeks ago, I said it's perfectly suited for physicians that are out, and EMTs and nurses that are out in the wilderness that are suffering from burnout and stress and thinking of leaving their careers. Just taking that time to feel the sun on your face, the wind through your hair, the beauty of God's world, these things naturally reduce your stress. In fact, in Japan, a very stressed out society, but they actually have some parks where they have blood pressure monitors along the trail, and they will take their blood pressure along the trail, and you can actually see blood pressure going down based on the amount of time spent out in nature. Some of the symptoms of recovery through present moment awareness, things like you can actually feel your heart slow down, you can feel your chest loosen up, you can feel relaxation. And those are signals from your survival brain communicating non-verbally to your thinking brain that, okay, we're realizing that we're safe now. What we're worried about is actually not a threat. One of the things that she talks about is fear of flying. How many in here have a fear of flying? Usually there's a large number of people. Nobody? Or you just don't want to raise your hand? A lot of people I talk to have this fear. Well, she uses techniques, and this can work for anything that we're nervous about, but while you're in the air, people that truly have a phobia from it, their survival brain is shooting out signals that we're in danger. So using present moment awareness won't work while you're at 37,000 feet because your thinking brain also knows, well, we're still very high up. But she says if you wait until you get to your hotel room or you get home, now you know you're on terra firma, you go into your bedroom, sit down on the floor, take your shoes off, sit up against the wall or the bed, and simply focusing on a point of contact of your body with the floor, with the wall, with the bed. And that present moment awareness technique, what that does is that communicates to the survival brain that we're being supported by a firm structure. And it sounds so simple, but it works. And it's just one example, but it actually works because it's a way we can non-verbally communicate with our survival brain. Now, how many people have difficulty sleeping? Either falling asleep or you wake up in the middle of the night. Usually when I ask that question, when I taught at my facility a couple weeks ago, every single hand in the room went up. And I can go to sleep right away, but I wake up every single night, usually about 3:30 in the morning. That's very, very, very common. So I knew when I was going through my extreme grief, I knew the importance of, because I'd been teaching these things prior to that, but I realized I needed to really put them in place in my own life. And I decided I'm going to use Dr. Stanley's present moment awareness technique with the fear of flying, and I'm going to adapt that to sleep. And it works. I've taught this I use it every single night if I wake up, and I'm back asleep within seconds. Some of the other techniques that are often taught, like getting up, drinking milk, doing something boring, I don't think those are very effective, and it just wastes time when you're supposed to be sleeping. And I've taught this at the Alert conference. I had a police officer the next day in a session tap me on the back, and he was so excited because he said it works. I've had a number of people tell me that. In fact, just recently, one of our contract employees, he couldn't sleep for a couple years now, since 2023, when he got back from deployment, and was just not sleeping. And so I gave him more than just this technique. We kind of went through a number of things that he needed to set up as a habit, and just getting ready for sleep. And he came to me the next week, and he said he's never slept better in his life. It sounds very simple, but it works. And so what I do is, and like I said, if it can work when you're in extreme pain, because grief is physical pain. It's actually physical pain. You can actually feel it emanating from the vagus nerve. I can point right where it's emanating from. If you can go back to sleep in those conditions, it can work for anything that's less than that. And it's simply this. You're simply focusing on a point of contact with your body and the mattress or the pillow or the bed. So if I'm sleeping on my stomach, often if my knee is kind of on the edge of the mattress, I'm just going to simply focus on that point of contact. Because what happens is, in the middle of the night, you're waking up, what happens? Your brain is starting to race, right? You're thinking about all these other things that you have to do, worries that you have, things that you're anxious about. Well, think of it in terms of the old stick shifts in the cars. What you need to do is you need to have ability to push it on that clutch. What that clutch does is it disengages the gears from the transmission. So that engine is racing, but if you push in the clutch and disengage the gears, you're putting it into neutral. We need to have a technique to which we can do that with our brain, and that's exactly what that does. The brain starts racing about things, but by physically thinking about just a simple point of contact, you're voluntarily putting it in neutral, and you're no longer racing on whatever it is that is bothering you. And I'm still surprised every single morning when I wake up, I'm like, oh, it worked again. So try that. It seems so simple, but it works. And it takes a while to get good at it. Because your brain will try to pull you right back into whatever you're worrying about. You just need to bring it right back in and just focus on that point of contact, and you'd be amazed how fast you'll fall back asleep. One of the areas that I think is vastly underserved, that I think every church member should be trained on, every pastor, every staff member, is that of psychological first aid. Has anybody had any formal training in psychological first aid before? Okay, a couple. Everybody needs to have that training, in my opinion. There's many different ways to get it. My favorite is the Johns Hopkins method, and I have no financial conflicts of interest whatsoever. I don't get any money from any of these things that I mentioned. I'm just saying what I've used and what's worked for me. You can do this through Coursera online. You can do it in a matter of several weeks. Just depends how much time you devote to it. But then it's certified through Johns Hopkins that you're certified in understanding this course on psychological first aid. The Johns Hopkins method sets itself apart from a lot of these other methods that are out there because it's driven by theory and it's informed by the evidence, but it's actually been empirically validated. And it's universally recommended by all these different agencies, including the American Psychiatric Association, but also the American Red Cross uses it as well. In fact, Everly and Lading, when they developed it, it was developed specifically for the U.S. State Department, and it's the largest government peer support program out there. And probably because, overseas, if there's some sort of terrorist attack or some incident, they're isolated from resources. So who do they have to rely on? One another. And that's the same with us in this room, too. Often, this may be the only type of psychological help individuals will receive, because often people won't go to get help. So the American Red Cross teaches this. They'll go into a disaster area and provide some immediate relief of basic needs like water and food. But what that is, essentially, and this is the central pillar of psychological first aid, it's providing a supportive and compassionate presence. Many people I found were doing that for me. They didn't even know that they were doing it, but it's nothing more than taking up space right next to somebody that's in deep emotional grief or sadness or fear, and just letting them know that you actually care about their suffering. And often, if you're like me, I used to be worried about what to say if somebody had lost somebody. I don't know what to say, and you would avoid those people, and that's the wrong approach. That's when they need you the most. But I want you to know you don't have to know what to say, because often you don't have to say anything. You can just sit there and you let them talk, and that is profoundly effective. Carly Posey, who was the mom of the son that survived Sandy Hook, she says her son would tell everybody he knew. She heard it 1,000 times. He was always talking about it. Every single person that he came across, he was telling him the story. And that's very, very important. So you don't have to say anything. You just be that supportive and caring presence, taking up space next to somebody. And in fact, according to Everly and Lading, it's actually superior in some ways to that multi-session therapy for reducing acute distress post-disaster. Why? Because of the immediacy of it. It's kind of like the Stop the Bleed program. It's more important sometimes to do that immediate intervention than it is things that may come later on, because the longer somebody goes from the crisis or the event, they may become harder to reach emotionally. So that's a very, very important window. We need immediate, because when under great trauma, there's very, very severe pain, and you need that pain relieved. And this is one of the ways that you can do it. And like I said, it doesn't have to be an active shooter attack. It could be somebody that's a friend of yours that's well known in the church that dies in a car accident. Everybody's going to be grieving. Well, there's not enough counselors out there, and that takes time. When we can have an immediate presence, an immediate first responder presence in the psychological realm is so important. And in any type of disaster, those mental health casualties are going to far outnumber those physical casualties. And under extreme disaster situations, an active shooter attack, these types of things, that distress and trauma and suicidal ideation, that can become potentially contagious. But so can calmness. Exuding this sense of calmness is very, very important. And FEMA and the American College of Surgeons, FEMA adheres to this, as well as the Red Cross, but the American College of Surgeons developed the Stop the Bleed program in order to gain a whole of community approach, a whole of nation approach, because that's the #1 cause of preventable death in the battlefield, but also in all trauma. #1 cause of preventable death is simply stopping that bleeding. Well, think of psychological first aid as kind of like the analogy to that, but in the mental health realm. It is immediate treatment and interventions, but it's designed for lay people with no prior mental health training whatsoever. This is the text created by Everly and Lading, which goes into great detail with scenarios and how to apply it. And they use the acronym RAPID. That R stands for rapport and reflective listening. It's simply sitting next to somebody, if it's somebody you don't know, building rapport with them, and listening to them and repeating back what they're saying. It tells them that you're hearing what they're saying. Then assessment, and this is especially if we have a larger number of people. What we want to do is assess like where they're at with it. How is that person responding to the event that they suffered? Are they in distress? Are they having difficulty thinking? Are they very, very sad, anxiety? Are they questioning their faith? Well, distress is very common in life-threatening events or disaster scenarios. Or are they experiencing a state of dysfunction in which they may be having hallucinations or panic attacks, showing signs of aggression and violence, or suicidal ideation? These individuals need a higher level of care and have to be recommended, maybe even hospitalization. The P stands for psychological triage. It's prioritizing if it's a mass casualty incident, but it's similar to the medical triage in which we're trying to do the most good for the most number of people. Who are the reds that need immediate evacuation and care? Who are the delayeds, the yellows, or who are the greens, the minors, the walking wounded? We want to kind of do a psychological triage as well. We can do it based on the evidence, things that they saw, things that you see in them. Are they having feelings of hopelessness? Are they showing that signs that they're not able to perform just the daily functions of living? That's evidence-based. Or is it risk-based, based on things that actually happened to them? Did they almost die, or did they witness human remains? Are they dislocated from their community, or did it have a disabling impact upon them? And remember, this is first aid, it's not surgery. The thing that sets the Johns Hopkins method apart is the interventions. Everly says that most psychological first aid models are going to be ineffective in a disaster scenario or any type of mass casualty scenario because they typically rely upon listening to what the person is saying and then referring them to another resource. Listening and then referring. They don't have any interventions involved. And those interventions are absolutely crucial in the immediacy of the trauma or of the grief. If they're psychologically unstable, we want to stabilize them. We want to remove proactive cues. You know, if there's a scene where there's people hurt or dead, we want to remove them from that. We want to use distraction. That works well with children as well. We want to allow catharsis, allowing them to talk through, just sitting next to them, letting them talk through it. That really, really is beneficial. The intervention's focused on giving them information. The more we can engage individuals in allowing them to self-rescue, giving them information, the power to cope with it, removing them from victim status to the survivor side of the equation, to the rescuer side of the equation where they're able to kind of rescue themselves and help themselves, the better their healing will be, and the more you're going to give them psychological relief from their emotional pain. One of the interventions is empower them, give them explanatory guidance. This is why it's so important. We're just scratching the surface. You need to dive in deep to these resources to see What are the types of things that they'll experience? If you can tell them ahead of time, so if you had somebody that you lost somebody in church and they're really, really sad, being able to just tell them, look, you may not eat for a while. That's normal. You may wake up with nightmares for a while or have visions of what you witnessed, something like that. Telling them ahead of time so when it happens to them in the middle of the night, they wake up, they won't think they're losing their mind. They're going to remember you saying, this is normal. What you're doing is you're depathologizing their reactions. You're telling them what is actually normal for a human that's been through extreme stress and trauma. And then they won't think that they're abnormal. So that gives them empowerment. They know, okay, this was told to me this was going to happen. Giving them anticipatory guidance, things that might happen. It may take you may have these dreams for a while, you may have these thoughts for a while. If you can, correcting misunderstandings of information. Often people may think that they could have done something to save this person. And that's totally impossible. Or they may think that something happened that they could have prevented, but their understanding is a misstatement of fact. If you're able to correct that, you can shift their whole perspective, where they realize, there was nothing I could do, or I did all that I could do and it just didn't work out. And reframing as much as possible, giving them a seed to move forward, giving hope in there. And then lastly, the D stands for disposition. That's where do we go from here? Remember the triage, psychological triage. Is this individual in such distress and dysfunction that we need to refer them to definitely get them a higher level of care as soon as possible, whether it be counseling or even hospitalization. Now, it's also important to understand, we need to talk about self-care. That's something that is often, so many individuals, especially in law enforcement, go through their whole career helping others, and at the end of their career, they become a casualty because they've not been practicing self-care the whole time through. And that's not just physical self-care, but it's also mental self-care. And this is important for everybody in this room too, because as we're dealing with the traumas of life, we have to be taking care of ourselves. All these things, the classic symptoms of PTSD, can manifest itself if we're not taking good care of ourselves. One of the most important things is diet, particularly in one sense a low-carb diet to reduce the amount of insulin that's constantly within our blood. There's more research that's showing that too much chronic insulin in your bloodstream, it may be one of the root factors of all chronic disease, whether it be dementia, Alzheimer's, stroke, heart disease, cancer. And in fact, they're now starting to refer to Alzheimer's as a type 3 diabetes because of this. So diet is critically important. And the thing that I find fascinating, there's three kind of prongs to self-care, and they all lead to better brain health. We talk about mental health, but really it's brain health, because your brain can break just like any other organ in your body. Things like you can get colon cancer, pancreatic cancer. Those are diseases of those organs. Well, dementia and Alzheimer's and Parkinson's, those are diseases of the brain. Psychosis, diseases of the brain. The brain can break in the same ways that your other organs can. But the thing that I find very fascinating is that each of these major areas of self-care, they feed upon one another. Having good sleep actually affects your gut microbiome, which is absolutely essential for proper brain health and mental well-being, and vice versa. Having a good colonies of beneficial gut bacteria actually improves your sleep, and it's the same with vigorous aerobic exercise. There's a lot of new research on that axis between your gut and your brain. In fact, they talk about the gut being your second brain, and you have trillions of bacteria that live all over your body, but especially within the gut. And there's more and more research being done on those species. Most of us, or most Americans, have too much of a ratio of bad gut bacteria, not enough good gut bacteria. And that can happen through a whole number of things, through diet, through stress. Chronic stress can affect those colonies. Overuse of antibiotics. If you remember when we were younger, doctors were prescribing antibiotics for everything. Well, broad spectrum antibiotics kill those good bacteria that are essential for our mental well-being. And we went through a period of time where they thought all bacteria is bad, and so kill it all. and how harmful that was to us as a population, as we're killing off those bacteria that are absolutely essential for our brain health. There's over 2,000 species that live in there, and they produce all those same neurochemicals that the brain produces, including serotonin, dopamine, and GABA. And there's more evidence that is showing that they profoundly affect your thinking, your thoughts, your moods, your behaviors. And it's bidirectional communication between the two. If we have chronic stress, though, there is inflammation, chronic inflammation of the gut, the release of cytokines. There becomes kind of a loosening within the intestines, and you can develop what's called leaky gut syndrome. You've probably heard that term before, in which those cytokines and bad bacteria can actually get into the bloodstream and into the system and cross up into the blood-brain barrier, and it can actually lead to anxiety, depression, and memory loss. And those beneficial gut bacteria, they produce about 90% of the serotonin in your body. 90%. Now that's different from the serotonin in your brain, but the more serotonin your gut produces, it communicates to the brain to produce more as well. And serotonin is a pretty well-known neuromodulator. That is essential for our well-being. And the idea is to have not just a large amount of beneficial bacteria, but it's a richness and a diversity. It's quantity, it's also quality, a big diversity of beneficial gut bacteria. The next, probably the most important element of self-care is sleep. If you don't who gets 7 to 8 hours every single night? It's a practice in your life. Who gets less than that? Who gets less than 6 hours routinely? If there's one thing that I can tell you today, it's make it a practice to strive for 7 to 8 hours of deep, restful sleep every single night. Your lives literally depend upon it. Having the right amount of sleep affects your health directly. In fact, the CDC calls lack of sleep in American society as a public health epidemic right now. It can lead to anxiety and depression, Alzheimer's disease, weakens your immune system, and all the big killers: cancer, cardiovascular disease, stroke, diabetes, obesity. And insomnia is the single strongest predictor of clinical depression. While you're sleeping, your brain is rewiring itself, and it's also flushing out toxins. Every 15 minutes or so, your brain there's a little bit more space while you're sleeping in the fluid between your brain cells. And it's able to flush out harmful toxins like tau protein that's shown up here in green, also beta amyloids, both of which are associated in high concentrations in Alzheimer's patients. Getting enough sleep is absolutely essential. A Natural Health and Aging Trends study, and in this Harvard study, what they wanted to look at was sleep deficiency across a large cross-section of individuals, and they wanted to compare that with risk of dementia and all-cause mortality. And they found that those that get 7 to 8 hours of sleep versus less than 5, there was statistical significance in the less than 5 hours per night category in having a higher risk of dementia and early death. In Harvard sleep study, very much the same thing. They found if you're getting less than 5 hours of sleep per night, you're at twice the risk in midlife, twice the risk of early dementia and early death. What's one of the big obstacles to getting really good sleep? It's this. So I would tell you, 45 minutes before you intend to go to sleep, put away all screens, all electronics, put the phone in the other room, put the computer in the other room, turn off the TV, and lay in bed with a good old-fashioned book. Printed material, not screens, printed material. That puts your brain in a state of relaxing, and it's not just the light from the phones. The screens themselves are overstimulating, especially on your children, because kids' brains, until about the age of 25, are still growing and developing, so they're impacted far more than we are as adults. But it's just that screen stimulation that amps up your nervous system, that fights your brain's ability to be able to fall asleep. The second most important one, falling asleep, is vigorous aerobic exercise. And this is any type of exercise that is going to get your heart rate up, where you're breathing heavily. Your brain is your own pharmacy. You're producing things like AMP and GABA. Both of those act as natural brakes on your stress response. They relax you, they help you sleep. And when you're engaging in vigorous aerobic exercise, you're producing a chemical called BDNF, brain-derived neurotrophic factor. John Rady, an outstanding book called Spark, he coined the term miracle grow for the brain, because when you're producing BDNF, you're producing a chemical that when placed in a petri dish with neurons, it actually causes them to sprout new dendrites. It causes them to really branch out, which creates, dendrites are how you make your connections within your brain. BDNF actually repairs neurons. It protects your body against the negative effects of that chronic cortisol in your bloodstream. And you can produce it yourself simply by engaging in vigorous aerobic exercise. They also found that individuals suffering from depression have very low levels of BDNF. That's why John Rady prescribes sometimes also medication, but for every one of his patients, he prescribes vigorous aerobic exercise because he said it is the best way we know of treating anxiety and depression at every level. Vigorous aerobic exercise, just getting that heart rate up, producing all those neurochemicals in balance, but particularly BDNF, which I mentioned. Duke University did a study looking at this. They wanted to compare how does exercise, which sounds simple, compare with taking medication. And they looked at sertraline, which is Zoloft. And they found that the exercise was as effective as the medication, as effective, and without the harmful side effects. And when you take a medication, that only impacts one type of receptor. The aerobic exercise, that impacts the entire brain. And they found the same or better effects after 6 months. The relapse rate was much lower in the exercise group than it was in the medication group. They're now looking at it in terms of using it as therapy for patients, and they looked at a year later, after they did that initial study, using something known as the Hamilton Depression Rating Scale. It's a standard instrument for measuring these things. And they found significant benefits even a year later, and it kind of topped out at about 180 minutes per week. That was kind of where it plateaued. It needed to really be getting about that amount of exercise, 150 to 180 minutes per week of vigorous exercise, anything that's getting your heart rate up to really gain those benefits. This journal found another similar study. They're looking at it as treatment of depression, especially in cardiac patients, and they found statistical significance with the public health dose, which was expending more energy. That's the vigorous exercise, compared to both the control group, which just did stretching, and the low dose group. So another study found the exact same results. Blumenthal was looking at it as a treatment for depression in cardiac patients. They looked at a meta-analysis of 25 randomized controlled trials and found the exact same thing. In fact, the exercise they found was more beneficial in terms of effects than the sertraline and the placebo. Now, one of the techniques that I mentioned earlier to talk about how you can bring your heart rate down if you're experiencing a stressful situation or a life-threatening event. Remember, if your heart rate starts pounding, it knocks your cognitive brain offline, your thinking brain. Well, who in here has heard of tactical breathing? A lot of you. Military teaches it, law enforcement teaches it. I used to teach it. But I found an even better method through Dr. Andrew Huberman. I don't know if anybody's familiar with that name. He's a neurobiologist at Stanford Medical School, and they study this in the laboratory. They study all types of breathing techniques. They work with Navy SEALs. They work with people that are facing phobias and fears, and they have found double inhalation breathing to be the fastest method of bringing down the stress level and the heart rate that we know of. Now, the tactical breathing it's like box breathing. Inhaling through the nose, holding for 4, then exhaling, then holding for 4, and repeating it. And that does bring down the heart rate, but what it also does is it builds your body's tolerance to carbon dioxide. Carbon dioxide is what drives your need to breathe. So that might be important for certain categories like snipers, free divers, certain situations like that. But for police officers, for physicians, for you all responding to a violent event, you want to maximize your oxygen. You want to maximize your shedding of carbon dioxide, not build your tolerance to it. So the double inhalation breathing, it's 2 inhalations, hold it, and then an exhale, long exhale, and then you hold it, and then you repeat it. That second inhalation, what that does is that's popping open those air sacs in your lungs, those alveoli. Right now, your lungs are only partially inflating. You are not maximizing the surface area in those lungs, so you're not maximizing your energy. That's why when we sit for too long, we get sleepy. That second inhalation pops them open. It maximizes the surface area, which maximizes the amount of carbon dioxide, the gas diffusion, get rid of the most carbon dioxide, take on the most oxygen, maximize our energy, and lower our heart rate more and faster than any other technique that they know of. In fact, I've proven this to myself just on the stair climber without changing my level of exertion. Just doing 3 sets of this, I can lower my heart rate by 10 beats per minute or more, just by simply doing 3 sets. So this type of thing we can use in anything, but it's so critical if you're responding to a situation that you're not used to. You're not used to the violence, right? So when that happens, you're gonna start feeling the tunnel vision, your heart rate pounding. You can use techniques like this to bring you back down so you can continue to perform. And then we talked about the being out in nature as well. It just automatically lowers our stress levels. All these things combined, I've used every single one of these things. In fact, one of the most important things I did when I was in extreme emotional grief, every morning as soon as I got up, I would walk. And I would walk for miles. Sometimes as many as 10 or 11 miles, just doing loops. It was 1.1 miles on the outside edge around my neighborhood, and it was one of the only things that would bring relief. And I would walk briskly. I didn't want to run because I didn't want to take the chance that I would hurt a knee or a leg or something like that, or a foot, because I needed this. And so I would do this walking. It was vigorous walking. I'm getting my heart rate up. Also rucking of a sack where you can carry a weight in it. That gets your heart rate up and is very beneficial. But that was the only thing that brought immediate relief, was that vigorous exercise every single morning. But all these things, what they serve to do is widen that window of stress tolerance that we can withstand. It allows that glass to be able to hold more water in it when you need it in life. And every single one of you in here are going to face storms. None of us are immune from this. And so we want to be able to face those storms as best as possible, especially when you're in a gatekeeper role, a guardian role, where you're being dependent upon to have a wider window so you can help others and not freeze yourself. And then they can act as allies. And so the important thing is that if you feel like your window is so narrow, you can do these things to practice recovery and take you beyond what's known as that fight or flight to what experts are calling the challenge response, in which if you are viewing every stressor as a threat, your body has a very specific psychological, physiological response to it. Your heart rate increases, but it also causes inflammation, increased risk of disease, and your blood vessels constrict. And that's associated with a lot of bad outcomes with overall general health, having blood vessels that are constantly constricted. But instead, if you view a challenge, or you view a stressor as a challenge, or better yet, an opportunity on how the good that can come out of it, it has a different physiological response. Your heart rate will still increase, but it's kind of like what it does with exercise. It's associated with better aging, cardiovascular, and brain health because your blood vessels are staying relaxed so that you can have greater flow in the bloodstream. And that's all simply done based on how your perspective is, on how you view things. Simply your thoughts. Your thoughts can actually turn genes on and off and cause different expression with your body. Entirely separate subject, but your thoughts are powerfully linked in to your physiological response in your body. And we'll talk quickly a little about the practical side of things. We mentioned run, hide, fight earlier, avoid, deny, defend, which is the alert model. Now I don't particularly, avoid, deny, defend, it's good, but I don't like the run, hide, fight because I feel like it was written by lawyers. I feel it's passive, and I don't like telling people that fighting is only the last resort. You don't have to be given permission by anybody to choose your course of action in a life-threatening event. And I don't like that one because it's kind of, I think it has the priorities backwards. Because sometimes fighting not be the last resort, it might be the first resort. And one of the things that goes along with that is it's important if you're in that type of role where you may have to respond to somebody like that. Or, sometimes this just comes to us. Like we didn't ask for it. We're not in a role, but violence visits us walking down the street or in a certain location. One thing that I recommend to people is if they're outside of law enforcement, if you've never been in positions where or scenarios where you're actually putting hands on somebody else, getting in their face, using force against somebody else, you're not going to rise to the occasion in the middle of a violent event. So that's why it's important to do these types of things ahead of time. One of the things I recommend is Krav Maga, because that is very, very good, especially when I talk to teachers, especially female teachers. Tell them this is a very good technique to learn. You get the practice of just being in somebody's face, putting hands on them, yelling at them, giving commands, because you have to practice this ahead of time. Now I think I like move, fight, evacuate better than those others because it flips it on its head. So it starts with the most critical situation first, and that's if our life is in immediate danger. We want to immediately move to get off the X, and then we have to make a determination. Do we have to fight, or then will we evacuate? So if we're always training, and like Officer Norton mentioned too, like if you're with your family, you can't just run and hide. And your kids are not going to be able to run very fast, and they may be frozen, and all these other things like that. And if you're with colleagues, you're not just going to run away from them. So it just doesn't work, and that's why I think it was written by lawyers, because there's a lot of CYA involved with that. But it's your responsibility to determine what your personal protection plan is for yourself and your family, and what you're going to do if faced with a life-threatening event where you have to use force against someone else to save yourself and your family or your friends. So the move, fight, evacuate, which we're just considering, is our life in immediate danger. We have to move and then bring the fight to the attacker. That's what I think the evidence shows. And I've co-presented with another presenter who they had an active attack at her college. She was the emergency manager for the college, and the student actually did that exactly, and he saved many lives because of it. A whole separate story though, but there's some evidence based in that, and a number of other case studies that I've looked at. If we're in immediate danger, we want to get off the X. Remember, the attacker can be at disadvantages as well, even if the attacker is armed and you are not. The tunnel vision we talked about, those perceptual distortions, those affect the bad guy as well. So simply moving a few degrees to either side, you may be in their blind spot. So often, attacking, bringing the fight to the attacker from the rear or a flank can be very effective. It may be the only thing you have. I mean, these are kind of last resort things that we're talking about. If the bad guy is talking or is reloading, these are times to bring the fight to the attacker. If our life is not in immediate danger, if the danger is somewhere over there, that's when we go to, okay, now we're going to evacuate or lock down. I've not come across a single instance where a bad guy has breached a locked door, so that's good news. So if you have a hardened door that you can lock from the inside, that's the gold standard, where you can get down prone away from the windows. But also, especially with kids, talk about this at schools, often the best thing you can do is evacuate. If the danger is in here, if I can get out those doors and just keep on going and go into the next neighborhood and just keep going, that's where the safety is, creating that distance between yourself and the attacker. Action always beats reaction. So like I said, sometimes you can gain a tactical advantage over an attacker, even if you're unarmed, by doing those things. One of the gold standards that we've learned how to actually survive and win gunfights is the use of simulated munitions. Think of kind of like paintball. So you have to do something like this. If you're carrying, you're expected to use a firearm to defend against a deadly threat. This is very, very important that you have some sort of training like this. And it actually is painful. It leaves welts, it breaks the skin. But every single one of those welts creates an emotional bookmark that feeds back into the automatic functioning of that survival brain. I can tell you, I remember vividly all of the wounds that I got from munitions, and usually in law enforcement, it's when you make a mistake. That's when the role players are cleared to take that shot. If you didn't clear a corner or something like that. If you made a mistake, and then guess what? I remember getting shot in the back because I didn't properly clear a corner in basic agent training. And then down the street, that was vividly in my mind because of those emotional bookmarks. Some very brief things on medical. It's important that everybody in here is trained up on some basic first aid, basic emergency life support. Number one cause of preventable death on a battlefield is massive hemorrhaging. That's why they created the Stop the Bleed program. They said this works in preventing trauma in the civilian setting as well. How do we stop the bleed? Direct pressure is often will stop most extremity bleeding. So having little kits, your hospital, little go kits where you have pressure bandages, knowing how to use them, but also tourniquets. Now, tourniquets are very important, and I think we get to the point where there's almost an over-reliance upon them. I just saw an article recently that was talking about, and we get a lot of information from the battlefield, but in Ukraine there's been thousands and thousands and thousands of unnecessary amputations because tourniquet was not necessary, but that's what they were taught to do. And so, if all you have is a hammer, you're going to just hit every nail with that hammer. Tourniquets are for very specific instances. If there's massive bleeding, if the blood is pooling on the ground, if the person is in altered mental status, they're going into shock because of so much blood loss, if their clothing and the bandages are blood soaked, if there's been an amputation or a partial amputation, these are all times to put on a tourniquet if it's extreme like that. And if you're within 2 hours of definitive medical care. See, in Ukraine, they don't have the same type of transport system that we did in Iraq or Afghanistan. They're relying on trains. So they're putting tourniquets on for relatively minor wounds that didn't require them. Direct pressure would have worked. And by the time they get to the hospital, an amputation is required. Coach Sanders at Columbine, if they had just known to do the stop the bleed protocols, possibly would have saved his life. Tourniquets did save the life of Steve Scalise when he was at the congressional baseball game. There was a doctor that put on a tourniquet, and then we got to the hospital, they said this saved your life. Like I said, I have no connections to any of these, but one company I like is North American Rescue. They sell bleeding kits where you can, a la carte, you can put your own things into it. You should have, these are the chest seals that we talked about. That should be in every one of your kits, along with tourniquets and pressure bandages. This is very crucial for any type of penetrating wound in what we call the box. So from the neck to the navel, front, back, sides, any type of penetration to your torso needs to be sealed off with something that won't allow air to get in. And that's what you can buy, these commercially available vented chest seals, but anything would work. I can go to a trash can over there, pull that bag out, tape that plastic over the wound, and that will prevent air from getting in. That's critical because air from the outside, if it's going into the pleural cavity where the lungs are, it's not getting into the lungs. What it's doing is compressing the lungs to a side, and eventually you won't be able to breathe anymore. So this is the second most preventable cause of death in the battlefield and in civilian trauma. So that's why it is so very important. A gunshot wound, a stabbing, an impalement, anything that causes an opening from the outside in through the pleural cavity needs one of these. And if it's a gunshot we're talking about, you need to also consider there may be an entry and an exit. And sometimes those exits are well hidden in armpits, things like that. So you really have to take the shirt off the person, remove all clothing, and you really got to search. You got to find those holes and you got to plug them with something like this. You also need to be certified in CPR. You have to do this regularly. You have to know how to do it and know where the AED is and know how to use it. That saves lives. Especially in a violent event, think of how many people may suffer from sudden cardiac arrest just from the stress of the event. So you may really have your hands full having to do other medical care subsequent to the actual attack. Now, Southwick and Charney, they looked across the spectrum of individuals that went through extreme trauma, and they wanted to see, is there a pattern of character traits that the most resilient individuals in society possess? Because if there is, we can emulate them. We can learn to be more like that. And these are the ones that they found. One, facing reality head on, not wishing that something didn't happen, not saying, just you got to face reality head on, meet it straight. Facing your fear head on. This is what resilience is. Making your trauma your platform for your own personal growth. One of my good friends from my court, Dr. David Andrews, he used his trauma with the Military Order of the Purple Heart out in Colorado to help others that were also suffering from PTSD. He had to be evacuated from the battlefield. He had traumatic brain injury. But he turned that around, and now he's helping others that are struggling with a lot of different things from combat. So he made his own trauma his platform for his personal growth. We have to be optimistic. Optimists live longer. We have to still be realistic, but optimism is like the kerosene that ignites resilience. And as Christians, we should all be very optimistic, right? Because we know who wins at the end. Death is not the end. So we should be overflowing with optimism. Social support, seeking and accepting it. This is absolutely essential. And I think this is one of the reasons why so many of our kids are struggling because of those lockdowns that they experienced. Isolating individuals, especially children, is going to lead naturally to anxiety and depression. And we have to be looking out for one another, right? If you see your family member or colleague is struggling, we have to be the one sometimes to reach down and help them. Admiral James Stockdale, he was a prisoner of war in Vietnam for years. Medal of Honor winner. He was actually Ross Perot's running mate, if you remember years ago when Ross Perot ran. But they asked him, how did you survive such extreme trauma? And he said it was the man next door. And it was literally the man next door because they were in these boxes. And they developed a tap code to communicate. So after one man was beaten and tortured, they could encourage him through a tap code. And the North Vietnamese captors didn't know they were communicating. They heard noises, but they didn't know it was a language. We actually learned that in combat survival training. We're exposed to it. But he said it was the man next door. He said, you are your brother's keeper. And I would tell you all in this room, we know as Christians, we are our brothers and sisters' keepers. Imitate role models. There's somebody else that's been through trauma, that has made it through, come across on the other side, post-traumatic growth. We can emulate that. As Christians, this should be obvious to us, relying on our inner moral compass, not cutting corners even when it gets tough. And religion and faith, for me, that was the number one thing that got me through what I was going through. The number one thing. It's the only time I've ever experienced this in life, but I actually feel as though I could feel people praying for me. And I don't know if you've ever experienced that. I never had before, but I would cry out to God to rescue me, and I could actually feel like I was being lifted up. Only time in my life I've ever experienced that. But most people will acknowledge that their faith becomes so crucially important in times of great distress. And we have to accept some things are beyond our control. You may be able to do some good, but not control the entire situation. We have to live with that. We just have to accept that. We can't have survivor's guilt, thinking, well, we could have done the miraculous, because we simply can't. Accepting our environment for what it is, not grieving for one that is lost, and becoming the rescuer, leaving behind your situation and trying to do things to help others. And then lastly, finding meaning and opportunity in the midst of adversity. There's always something we can find to give the glory to God and steal a little bit of the power away from the enemy. Viktor Frankl, he said, if you have a why, you can bear almost any how. But my call to action to you is to develop that mindset today, not tomorrow. We don't put off to tomorrow. Make an action plan and say, I'm going to do these things today so they'll be there when I actually really need them. We talked about Columbine. This was, the event that really changed much of this thinking and police response in America. At one of the alert conferences on the anniversary, the 20th anniversary, was held up near Columbine. So I traveled down to visit the school because I thought it'd be appropriate. And there's you can't go into the school, but there's a little memorial right there. And at the end of the day, it was late, it was getting dark, it was drizzly, it was kind of gloomy. And it's up on a hill, and then from this perspective, you can see the school in the background and the memorial. But then on the left there, you can see those lights. There was after work softball tournaments going on. And you could hear the sounds of people laughing. And it really just kind of struck me because it's so gloomy, and you're thinking about what Columbine represented and what happened there. But yet then you hear the sounds of laughter. To me, that struck me as being the picture of resilience. They had a number of placards right there by students and teachers. They didn't understand why that happened in Columbine. This had never happened before. Columbine was no different from any other school. They weren't training for this. Teachers were just doing what they did every single day. And then this one wasn't attributed to anybody, but I thought this one was the most powerful. It said it brought the nations to its knees, but what have we learned? Because if we haven't learned anything, then those deaths are in vain. All bad situations that we don't learn from and change for the good, it's in vain. And I would submit to you one of the most important things that we learn from that is the importance of relationships. And that's the other thing I really want you to take home today. I want you to think about the distraction in your life, and maybe if there's some relationships you've been neglecting, because we don't know what tomorrow will bring, right? None of us knows. So we need to prioritize those relationships in our life that we've been neglecting, because those are what matters the most. At the end of the day on 9/11, so many stories of people getting home from work all around the country, not just in New York or Washington, D.C., and racing in and scooping up their kids out of the bed and just holding them, because they realized how fragile life is and how things can just turn on a dime. And we've also learned that we have national resilience. Up in New York, we created the memorial, just like in Columbine. This is very, very important because we have to honor those that heroically gave their lives and that were killed on that day, but we don't stop there. We have to move forward. That's resilience. So what did we do? We rebuilt. We rebuilt this beautiful building to the symbolic height of 1776 feet by the symbolic native freedom. And so when first responders still drive by there, they don't see just a hole in the ground. They see this beautiful new structure right where it is. We came back, we rebuilt, and we moved forward. And the same with the Boston Marathon that we referenced earlier. We didn't stop this iconic event. We said, no, we're going to continue this, and we're going to grow from it. We're going to exhibit post-traumatic growth. That's the essence of true resilience. And once again, that's your call to action. If you're feeling like your window is so narrow, you can take it within your own hands to do these things, to take back control and widen that window of stress response that you have. Here's my information. Take it down, connect with me on LinkedIn or text me, email me. I'm more than happy to share more resources with you and with your staff members. If you have recommendations for more research from me, I'm always happy to receive that. If you have any questions about anything, please reach out to me. Thank you.